What are the possible costs to an organization an accident in workplace? Direct costs. First, aid treatment, sick pay, repairs to equipment, lost or damaged product, lost production time, overtime cover for the injured person, fines in criminal court, compensation payment to victim, indirect costs, investigation time, lost employee morale, cost of additional control measures, compliance with enforcement notices, cost of recruiting and training additional employees, for example for cover, damaged customer relationships, damaged public image. What are the direct cost and indirect costs? Direct costs may include: first, aid treatment given to the victim, sick pay if they are off work, overtime costs incurred to cover their absence, repairs to damaged equipment, lost or damaged product arising from the accident, lost production time. In the event of legal action, there may also be fines or compensation payments. Indirect costs may include the time taken to investigate the accident, the costs of additional control measures to prevent recurrence and to comply with enforcement notices, costs associated with the training and recruitment of additional employees. There may be a loss of morale in the workforce, which could impact productivity. Damage to the organization's public image or customer relationships. What health and safety targets might usefully be included in the Statement of Intent section of a health and safety policy? Targets and objectives. Meet legal requirements. Safe workplace. Equipment. STEMS. Provision of training and information. Risk assessment. Adequate resources. Communication and consultation with workforce. Reduced accidents and ill health. Carrying out active monitoring. Organization, purpose. The responsibilities for implementing policy. Identifies operational duties for health and safety. Identifies chain of command. Identifies roles and responsibilities. Covers all levels of the organization, from director to shop floor. Includes specialist roles. For example, first aiders and safety advisors. Arrangements, purpose. The arrangements for implementing policy. Arrangements in place to manage health and safety. Specific arrangements for key risks. Explain the purpose of the organization section of a health and safety policy. An employer may identify a range of targets in the Statement of Intent. The organization's compliance with the law. The provision of a safe working environment with safe equipment and procedures. The developments of risk assessments for business activities. The provision of information and training to employees as a result of the risk assessments. Targets to reduce the accident rate in the organization. A target to carry out active monitoring to reduce workplace hazards. The arrangements section of a health and safety policy. The purpose of the organization section of the policy is to establish the roles and responsibilities for health and safety at all levels within the business, from director down to shop floor and office employees. The organization section will also include specialist safety roles, such as fire wardens, first aiders and safety advisors. The organization section identifies who is going to deliver the objectives in the health and safety policy. The purpose of the arrangements section of the policy is to establish how the safety policy is to be achieved. This is done by producing procedures which detail how hazards in the organization are to be identified through risk assessment and controlled, for example fire, first aid or spill response. In this way, everyone can see how the health and safety management activities are to be carried out. What is the meaning of the term perception? Perception can be defined as the way people interpret information they take in through their senses, for example hearing and sight. Different people will perceive things in different ways. Explain the meaning of the term risk and give a workplace example. Risk is determined by considering the likelihood of harm occurring and the potential severity of harm, damage or loss. For example, if working with faulty, mains, powered electrical equipment, there is high probability that an electric shock could be received, and the potential result is death. What are the key stages of a risk assessment? Identify the hazards. Identify who could be harmed and how, including workers, visitors, contractors and vulnerable groups such as young persons, new and the disabled. Evaluate the risk, considering likelihood and severity of harm, and decide on precautions. Record the significant findings and implement them. Review and update as necessary. What are the active, proactive monitors? Safety tours, safety inspections, safety survey, safety sampling. Safety tours carried out by managers to monitor safety standards and identify hazards. Safety inspections carried out by a safety representative. Survey to monitor noise levels by a specialist. Safety sampling exercise to check compliance with rules on the use of PPE. What are the reactive monitors? Accident reporting and accident data. Ill health, absence reporting, data. Incident reporting, including near misses. Complaints. Prosecutions and enforcement actions. Cost of claims. Property damage reports. Collecting accident and incident data and reports, and analyzing trends. Analyzing absence and sickness data. Reviewing complaints from employees. Calculating the cost of claims brought due to injuries, and analyzing trends. Give the meaning of the term health and safety audit. Systematic. Critical. Independent. Information. Effectiveness. Reliability. Corrective actions. A structured, systematic, critical review of independent information collected on the effectiveness and reliability of the organization's health and safety management system and suggested corrective actions. List key areas that may be covered within a health and safety audit. Health and safety policy. Allocation of roles and responsibilities. Risk assessments. Specific hazard control. Fire safety. First aid. Contractors. Accident reporting. Consultation. Maintenance of records. Recommendations. The key areas to be covered by a health and safety audit will be the organization's health and safety policy, ensuring that one existed and that it was communicated to employees. The audit should check that roles and responsibilities for health and safety have been allocated to individuals and that they understand their roles. The audit can review risk assessments to ensure they are suitable and sufficient, their current and actions identified on them completed. The audit should ensure that specific hazards such as manual handling, work at height or the control of substances hazardous to health are appropriately managed. Auditors can ensure that fire safety is properly managed with emergency procedures in place. Arrangements for first aid can be audited to ensure provision is adequate, as well as auditing arrangements for the control of contractors. Auditors may cover accident reporting both internally within the organization and externally reporting to the authorities. Auditors should review the arrangements for consultation within the organization and ensure that consultation does take place. Auditors can consult maintenance records of machinery to establish that guarding to machines is maintained, as well as ensuring those machines with a statutory requirement for maintenance are maintained. Auditors should also provide recommendations for improving the existing system. Explain how the findings of a health and safety audit can be used to improve health and safety performance. Compliance versus non-compliance and reasons for failure. Strengths and weaknesses, enabling benchmarking. Informing and enabling remedial action. Evidence of commitment to health and safety, communicate findings. Prioritizing and resource allocation. Continual improvement. The findings from a health and safety audit may be used to distinguish areas of compliance with legislation from those areas that do not meet the necessary standard to comply. The audit should also identify the reasons why non-compliance exists and the nature of the non-compliance. The audit may also have distinguished areas of strength from areas of weakness in the management of health and safety. This may facilitate benchmarking by management with other organizations to ensure they are managing health and safety responsibilities in line with industry standards, and to assist management to direct often scarce resources where they are most required. The findings from the audit can be communicated to staff to ensure that standards are maintained or improved and to indicate that management is motivated to be proactive in the provision of a safe place of work, keeping health and safety on the business agenda. An audit enables management to follow a program of continual improvement by focusing eliminating deficiencies.
Please give comment and suggestions.
Thank you.
Subscribe our YouTube channel and hit the bell icon for more updates. Thank for visit our channel. See you next class.
Thank you.